What causes sudden hearing loss, and how do doctors diagnose it? Imagine waking up one morning and suddenly hearing nothing or very muffled sounds in one ear. That's what sudden hearing loss feels like, and it's a medical emergency. Sudden hearing loss, also called sudden sensorineural hearing loss, happens when hearing drops quickly within a day or less. It affects the inner ear, specifically the cochlea or the hearing nerve, rather than the outer or middle ear. Because it develops so fast, prompt medical attention is essential to improve the chances of recovery. Most cases of sudden hearing loss are called idiopathic, which means doctors can't find a clear cause in about 85 to 90% of patients. However, when a cause is identified, it often involves viral infections. Viruses can damage the delicate sensory structures inside the inner ear, leading to hearing problems. This is why steroids are commonly used in treatment, as they help reduce inflammation that might be caused by viral activity. Blood flow issues are another important factor. When blood supply to the inner ear is disrupted, it can cause sudden hearing loss. Conditions like high blood pressure, high cholesterol, and diabetes can increase the risk because they affect blood circulation. Trauma or injury to the head or ear can also cause sudden hearing problems. For example, loud noises from explosions or accidents can damage the inner ear structures directly. Certain medications known as ototoxic drugs, which harm ear tissues, can also trigger sudden hearing loss. Sometimes, when both ears are affected at the same time, it may be linked to autoimmune diseases, infections like syphilis or tumors. Excessive strain or pressure changes in the ear can cause a rupture in the inner ear membranes, leading to sudden hearing loss. Risk factors include lifestyle choices such as smoking, drinking alcohol, or experiencing stress, as well as underlying health conditions like autoimmune disorders or vascular diseases. Diagnosing sudden hearing loss involves a careful process. Doctors start by asking about when the hearing loss began and whether it affects one or both ears. They want to know if the loss happened suddenly or gradually, since gradual loss might be related to other conditions like Meniere's disease. The doctor will also ask about symptoms such as ringing in the ears, dizziness, ear pain, or discharge, which can give clues about the cause. A detailed medical history helps identify possible reasons, like previous ear surgeries, exposure to loud noises, or recent illnesses. To measure hearing loss, audiologists perform hearing tests called audiometry, which determine how much hearing has been lost and whether it's sensorineural or conductive. Imaging tests like magnetic resonance imaging scans may be used to look for tumors or structural problems in the inner ear or brain. Because many conditions can mimic sudden hearing loss, doctors need to differentiate true sensorineural loss from other issues like ear infections or wax buildup. This careful evaluation ensures that treatment is started quickly, which is crucial because, even with prompt care, some patients may not fully recover. Early treatment with corticosteroids offers the best chance for improvement, but the outcome can vary based on the cause and severity. Understanding what causes sudden hearing loss and how it's diagnosed highlights the importance of seeking immediate medical help if you experience sudden hearing changes. Every case is unique, and a healthcare professional can provide personalized advice and treatment options to give you the best possible outcome. Remember, timely action can make a significant difference in preserving your hearing health.